question then.
Okay, go.
More than 500,000 people are expected to die of cancer this year. That's more than 1,500 per day. On average, 1/2 of men and 1/3 of women will develop cancer. My purpose is to inform my audience about cancer. Cancer can affect anyone, so you can gain something from this speech by being informed about cancer and how to prevent it. Cancer is a serious disease that may be preventable and curable. I will discuss what cancer is, ways to prevent cancer growth, and different types of treatment for cancer. This disease is caused by uncontrolled division of abnormal cells in a part of the body. A malignant growth or tumor resulting from the division of abnormal cells is also another form of cancer. Cancer is a condition of uncontrolled growth of abnormal cells. Normal cells usually grow and divide to replace old or dead cells. Cancer cells continue to grow and divide, and they also accumulate in one place. The accumulated cells form tumors. Tumors destroy the body cells. Two types of tumors are malignant and benign. Cancers are classified according to the body part in which it originates. There are measures that can be taken to lower his or her chance of developing cancer. Lifestyles can affect the changes of future cancer development. Smoking can cause lung cancer, drinking, liver cancer, chewing tobacco, mouth cancer. Be active and maintain a healthy weight and eat healthy and try to avoid fat foods. There are various treatments for cancer. Surgery is one of the oldest. 60% of patients receive surgery for their cancer. Radiation is another form of treatment for cancer. This uses high energy particles that are injected into the body, and it's extremely tough on one's body. It's very effective, but it does have its side effects. Skin problems like dryness, itching, peeling, sometimes blistering, and fatigue are the most common throughout all your radiation treatments, and it will most times continue after it is over while your body recovers. Dry mouth, mouth sores, and gum sores are also side effects of radiation. Difficulty swallowing, bladder irritation, and changes in women's menstruation. Radiation is given in several different places. It can be given in the head or the neck, in the chest, the stomach, and the abdominal cavities, and the pelvis. The next form of treatment is chemotherapy. It is almost as effective as radiation because the drugs go into your bloodstream and then they're circulated throughout your body. Chemotherapy is the treatment of a disease by the use of chemical substances, especially the treatment of cancer by cytotoxic and other drugs. Oral chemotherapy can be taken by mouth. Subcutaneous injections are under the skin. Intramuscular is another form. Intravenous is an IV, obviously. The forms of IVs are an angiocatheter, which are placed in a vein or in the arm and removed after chemo is given. A PICC line is another form, and it is used for only 6 weeks to a month, or to a few months, rather. There are non-tonal catheters, tonal catheters, and a portacath. And the portacath is the more permanent option. Side effects of chemotherapy are fatigue all throughout the body, pain, including headaches, muscle pain, stomach pain, pain from nerve damage such as burning, numbness, or shooting pains, usually in the hands or feet. Some people have permanent nerve damage. Mouth and throat sores are other side effects. Diarrhea, nausea and vomiting, blood disorders, hair loss all over the body, sexual and reproductive issues, changes in your thinking and memory, also cognitive changes or cognitive dysfunction. So to wrap this up, cancer is a condition of uncontrolled cells that evolve into tumors. Fatty foods, smoking, drinking, and chewing tobacco can all affect the chances of developing cancer. Treatments for cancer include surgery, radiation, chemotherapy. Anyone can become a victim of cancer, but we can decrease our chances of getting cancer by being more informed on the disease and how to prevent it.